Good afternoon, everyone. Welcome to today's eLotus webinar. Before we begin, let me ask you this. How many of you have had patients recovering from stroke, Parkinson's, or other neurological disorders where progress just feels painfully slow, no matter what you do? What if you could stimulate measurable change, help your patient regain speech, improve motor control, or even take their first steps again with just a few precisely placed scalp needles? My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. At eLotus, we have been hosting educational courses for over 3 decades and are proud to be your trusted source for premium CEU content, featuring over 200 speakers, 700 courses, and over 3,000 hours of CE. We truly appreciate you all for joining us today. Today's class is 43 years of clinical expertise. Chinese Scalp Acupuncture for Complex Neurological Disorders, sponsored by Evergreen Herbs. Chinese Scalp Acupuncture, or CSA, is one of the most powerful tools in modern acupuncture, blending traditional Chinese theory with modern neuroanatomy. This technique can bring astonishing results for conditions like stroke, multiple sclerosis, Parkinson's disease, autism, cerebral palsy, post-COVID syndrome, and more. It's an honor to introduce today's speaker, Dr. Jason Hao, a leading authority on scalp acupuncture and a true pioneer in the field. Dr. Hao has been practicing and researching scalp acupuncture for over 43 years and has taught across the US, Europe, and Asia since 1989. He currently serves as president of the Neuroacupuncture Institute, vice chairman of the Education Guiding Committee at the World Federation of Chinese Medicine Societies, and was former chairman of the Acupuncture Committee at the NCBAHM, formerly known as the NCCAOM. Dr. Hao is the co-author of the textbook Chinese Scalp Acupuncture and the editor-in-chief and translator for Acupuncture and Moxibustion, published by the World Federation of Chinese Medicine Societies. His groundbreaking work has been featured in numerous media outlets, and his success treating veterans at Walter Reed Medical Center was highlighted in the acclaimed documentary Return to Life. His newest book, Neuroacupuncture Restores Life, became an Amazon bestseller upon release. With over 4 decades of experience and countless clinical successes, Dr. Hao has so much valuable knowledge and inspiration to share with you today. If you're interested in more scalp acupuncture, we highly recommend also checking out Tsusen Kao's courses on Yamamoto New Scalp Acupuncture, YNSA, as well as the late Carl Tai's scalp acupuncture section on Core, which is our collection of real essentials, where we compiled his complete acupuncture system and techniques over the course of several years, and now we proudly pass it on to you. This information is all located on www.mastertongueacupuncture.org under the Explore More section, and I will also put the links in the chat room for you. If you're here live and can both see the chat room and hear the presentation, your attendance is already being tracked. Just be sure to stay until the end of the webinar to qualify for the CEU quiz. A notification with directions will be sent to the email associated with your eLotus account when the quiz is available within 24 hours. And lastly, a quick reminder for any new attendees joining us today. Please make sure to set your chat from host and panelists to everyone so we can all be part of the conversation. To submit any questions during the presentation, please use the Q&A box so they remain organized and easy for us to answer. Now, let's begin today's webinar, and please join me in welcoming Dr. Jason Hao.
Hello, everyone. This is Jason Hao, the president of Neuroacupuncture Institute in America. Sorry, we have a little bit technical problem, even we practice many times. I'm not that smart. Anyway, feeling very honored to be invited by eLotus to share my 43 years experience on scalp acupuncture. And first of all, I'd like to thank eLotus team, Menière, and Sam do all the prepare and coordinations put there together. Also take this opportunity to thank the Evergreen sponsor this webinar and make it available. Thank you, Myra. Very nice introduction for me, and thanks to you all. Most important, come here to join me to discuss this today's topic, the scalp acupuncture for the treatment of neurological difficult disorders. Next. As you know, there's many types of scalp acupuncture so far in the West. And today I'm going to introduce most popular one, gel style scalp acupuncture. I graduated in 1982 and learning directly from Grandmaster Dr. Sun Shentian. And Heilongjiang University is the top university to do research, clinical trials, and practice for scalp acupuncture. So we mainly use gel style scalp acupuncture, Sun style, that's our teacher, and the CEUs style. Next slide, please. And so I've been teach Western English speakers since 1989, and I've been traveling all over the world introduce this technique. Besides do scalp acupuncture, also I'm a Chinese artist, so I do Chinese calligraphy and Chinese painting. And so most of the paint in this class is my painting in the past. Next one. You know, the public in the West mostly only know acupuncture pain. Acupuncture is a major tool to treat mostly challenge complex neurological disease. Is a new concept, new idea. Since I come to the United States, many newspapers, TVs, radios, journals have reported my cases and treatment for many neurological diseases. This is some of that. And you can Google Jason Hall scalp acupuncture or Jason Hall neuroacupuncture. Many of our film and articles will come up. Next one, please. Today we'll spend 4 hours brief introduce the follow content. We'll generally review anatomy and physiology of the brain. Mostly we spend time to help you review if you already learned or help you to learn, stimulate area and the indication of Chinese scalp acupuncture. And for the indication part, I have developed a lot since I come to the United States. So the most practical is my 35 years in America experience. And we'll introduce some cases and do some demo. And for discussion portion, beginning each hours after we are break, I will let you answer some question, give answer in the end of the class. We'll have review. Next one, please. Let's generally introduce scalp acupuncture. Scalp acupuncture is a contemporary acupuncture technique integrating traditional needling methods with medicine knowledge, neuroanatomy, neurology, and neuroscience. This technique is relatively new compared to regular acupuncture that is have 3,000 years of history. In 1950s, China, mainland China, started encouraging Western educated doctor to learn acupuncture and Chinese medicine. There's a group MDs start learning acupuncture, then try to do some research, see how this acupuncture and the Chinese medicine they can integrate it together. There's many famous people in 1950s. It took about roughly 20 years, and a few of them become more popular. One is Jiao Sunfa, is the most popular one, and one is Fang Yunpeng, Fang style scalp acupuncture. And I just see eLotus is going to introduce Fang style scalp acupuncture on April. Please join that. Very useful. In 1977, Jiao style scalp acupuncture was first time introduced in Chinese acupuncture and moxibustion book. I was the first group able to learn this technique. In 1980s, my university two leader professor, Dr. Sun Shentian and Dr. Yu Ji-sun, both of them were my direct teacher. So they did a lot of more research and developing a lot for Jiao style scalp acupuncture. The Western world, the rest of the world, get introduced the scalp acupuncture at first the International Acupuncture Conference in Beijing in 1987. Luckily, I was the interpreter and organizer for this conference, so able to learn this and help them introduce this technique to the rest of the world. In the conference, and while the doctor demonstration scalp acupuncture treated a stroke and patient able to get up and walk. So then this technique go to rest of the country, world, our country. And so 1989, and was the first teacher come to United States and in my university to teach acupuncture and Chinese medicine. So I started introduce this technique, and local people have been get beneficial, and many local newspaper and TV, radio start introduce this. I'm currently and practice in Santa Fe, New Mexico, and also established school. There's two schools I established in the past. One is the International Academy of Scalp Acupuncture, and 10 years ago, 11 years ago, I established Neuroacupuncture Institute and in Santa Fe, New Mexico. In 1987, I was invited back to China and as a case speaker, and I introduced the scalp acupuncture for treatment of phantom pain. We're going to touch that disease, and when we talk about special areas, 2011, I and Dr. Linda Hao published our first book, Chinese Scalp Acupuncture, and by Blue Pulpit Press. Then we start our rest of the world to teach this. Next one, please. That's the major technique I'm going to introduce, the founder in the Jiao style scalp acupuncture. Likely in past 35 years, I'm able to directly learn a lot from Dr. Jiao and help him translate some of his class. And so, and thanks to Dr. Jiao creates this technique, they benefit us practice and benefit thousand people have neurological disease. Next one. That's my teacher and Dr. Sun Xintian in Harbin, Heilongjiang province. Guess what? The Dr. Sun is 88 years old, but he still treats patients every morning. And he treats about 80 to 100 patients per morning. So he has so many students around him. He just put needle in and talk to patient, do evaluation, and rest a PhD student and master's school student continue to patient care. And Dr. Sun Jingtian had his 80 years birthday 8 years ago in Harbin. There's a couple thousand his students will all go back to celebrate. And thank you, Dr. Sun Jingtian. Dr. Sun Jingtian is very strong for neurological examinations. So is truly the leader for integrative medicine. That's what I practice in Santa Fe, New Mexico right now. Next one. That's another famous scalp acupuncture my teacher, Dr. Yu Jisun, called Yu-style scalp acupuncture. And today we don't have time to talk about that. Maybe in the future we can introduce a little bit his technique. Next one. So, when you practice, when you treat patient, they all ask you a question about what is the scalp acupuncture? What is different this scalp acupuncture? This is our book. So scalp acupuncture is a contemporary acupuncture technique integrating two systems, traditional needling stimulation technique in Chinese medicine with Western medicine knowledge, neuroanatomy, neurology, and neuroscience. Scalp acupuncture has been shown great results with difficult neurological disease. Most common one like a stroke, multiple sclerosis, traumatic brain injury, PTSD, Parkinson disease, phantom pain, cerebral palsy, autism, and long COVID. I have treated that lately. Next one, please. So, the clinical application scalp acupuncture is very big. If you read the book, we write. So there's many cases there and many chapters talk about all neurological disease. Basically, I put there in 4 categories. Number 1, they treat a disease have blood vessel disorders like a stroke, okay? And they also treat like infection, brain disorders, meningitis, encephalitis. They also treat a lot of genetic and degeneration disorders and like multiple sclerosis. And of course, in Western, the more major transportation is the car, airplane, there's a lot of accident, damage the brain. So we can treat a traumatic brain injury, traumatic spinal cord injury, and that called paralysis, and lots of balance, lots of speech, we have good results. In the clinic, we treat a lot of people who have a tumor and cancer treatment, and they cause a damage for part of the brain, cause a lot of neurological condition. We have pretty good results. And also, there's other reason like poisoning, malnutrition, immunity disorders, or long COVID. You know, in past 5 years, there's academic and pandemic disorders. Majority of the people in the world have COVID or have a COVID vaccine, and they both of them can cause a long COVID. And the scalp acupuncture have shown excellent result to treat those kind of disease. Next one. So scalp acupuncture can treat those kind of disease. What in the clinic, they mostly appeared patient paralyzed, loss of speech, loss of balance, and lot of kind of tremor and strange pain. Regular acupuncture don't have good results, but scalp acupuncture often produces remarkable results with just a few needles. And they are so quick, sometimes they only take several minutes to achieve good results. Next one. So, Jiao style scalp acupuncture, basic total 16 areas. And I modify a little bit that at one areas in the brain called head areas, basically in the middle of the from the hair here 2 centimeters up, 2 centimeters down. I call this is head areas, and we're talking about more details. If some people are ready to learn, that's the area you need to learn. I'll review. If you never learn, so you can go to many books, and we gathering about 50 professors in all over the world 5 years ago. So we come out a new updated textbook, and theory and the practice of acupuncture and moxibustion. There's 3 editor-in-chief. Number 1 is Dr. Shi Xumin, and very famous academia and developing and Chinese developing acupuncture a lot. Unfortunately, Dr. Shi Xumin, we lost him. He passed away last year. We miss him. And number 2 is Dr. Liang Fanrong. And Liang Fanrong is the president of Chengdu University and of Chinese medicine. And he did a lot of high-level clinical trial and research for mechanism of acupuncture. I'm Jason Hao. I'm number 3 in this book, and editor-in-chief. Also, I'm the only one to translate in chief. So the Chinese version is published, and we finished the English version is in publisher hand. And when the final English book published, we're going to have 183 countries use this book as a textbook. So mostly in the past, in the West, we use Chinese acupuncture and moxibustion, and that is the major book. That book has been used for past 50 years. That's a new updated Chinese book. Okay, all right. And so in this book, there's a chapter talk about scalp acupuncture. I did wrote it, that portion and translated too, so that you can get it, or you can get it from this book. And it's a major introduce the theory, the technique, the location. Mostly we contribute this book to the rest of the world as an indication. So, or you can go to other textbook and find this symbol location. Next one, please. Anatomy and the neurology of the brain can be introduced in multiple layers. Even in the Western medicine and the university, and there's a course can be last for a couple of years. So in this 4 hours lecture, I'm going to just introduce something mostly important related to Jiao style scalp acupuncture. That the cerebral cortex, cerebella, and that mostly the Jiao style scalp acupuncture used to practice. So that the brain, and you can see, so it's the same like in the PowerPoint. So each part of the brain and have many deep crack there we call sollicus. Yeah. So sollicus, between sollicus part of brain raise up called gyrus. So I'm going to say this terminology a lot. Remember, sollicus is a deep crack between, and between this deep crack, something raise up, they call gyrus. So mostly we're going to introduce today is called motor gyrus. Okay, right here, and behind that is called sensory gyrus. So that mostly we use in the clinic treat paralysis, and people have central related the pain like phantom pain, CRPS. CRPS is complex regional pain syndrome. I have wonderful results, and I'm going to introduce to you. And so brain generally divide into 4 lobes. Let's go back to PowerPoint. Thank you. Next one. So cerebrum includes frontal lobe, right there, parietal lobe, right there, occipital lobe, right there, and temporal lobe in green. So we use many sollicus divide the brain into 4 parts in order to learn that easily. The normal brain, they're all together, they don't divide it. So that the central sollicus, in front of the central sollicus is about temporal lobe, is called frontal lobe. So most important in frontal lobe is these areas we just show is motor gyrus, control movement of opposite side of the body. So left control right, right control left. And the forefront sollicus is very important to all the mental, emotional activities like memory, sleep, and all the emotional. treat a lot of emotional disorders, anxiety, depression, for example. We all stimulate these areas. The parietal lobe is behind the central sulcus, and the most important directly is this one called sensory areas. And this treat a lot of pain related to central nerve disorders. Occipital lobe in the purple is easy to understand, and there's control the vision. Mostly complicated is this temporal lobe have many functions. In jaw style, we introduce the dizziness areas, hearing areas, and speech 3 areas. And this is a cerebellum, and is a major function in the back of the head, occipital, below the occipital lobe. So it's a major area control the balance and the coordination. And also we're going to introduce a little bit interbrain brain step, and if we have time. Next one, please. You know, the blood supply of the brain is very important to maintain normal function of the brain. So, if you remember, when we learned the physiology, the human brain is only about 2% of total body weight, but they consuming up to 20% of blood supply and energy, their oxygen energy. So a lot of brain damage, stroke, and even Alzheimer's and some other patient, they all relate to blood clot cut. And so this image show the blood clot cut here, there are damage, this part of the brain, and depend where is it cut, and this part no blood supply, there cause a lot of problems. So knowing the arteries and which branches support which part of the brain is relatively important. Next one, please. So, the blood supply in the brain is so important that human being brain developing is a very, very smart way. So there's a lot of network. Even one part of the brain, if they get some blood clot, for example, cut right there, but the blood could have some detour, the blood come support that. That's a part of the mechanism. Some people get damage, but they still can get recovery. I choose this one of the slides I want to give. In the bottom of the brain, so it's a lot the current of the blood supply is very important here to know. So, and if you take my class in the final, I will have the question about this area as well. Next one. We have limited time, so we are going to introduce mostly a few areas in the brain. And as we say, one is let's say motor areas from 4 is the green right here, control the movement of the body of this size. Now in front of that is the small areas we call tremor areas. Tremor areas control the involuntary movement, and behind the motor areas is sensory areas, and so they control opposite side the sensation in the body, and this area called most popular use area called foot motor sensory area on top of the sensory and the motor area, right? Like here, there's a 2 point each side. Next one, please. That show and that chart comes from our book and scientific very famous artist. We designed that three-dimension chart to give you more ideas how they look at that. And the left side, you will see how we measure it on the scalp surface, and we call motor areas and the sensory areas. If you're MD, learn acupuncture, we can call physician acupuncture program, and this guy is a very famous owner for HAMS Medical Institute, is training MDs. I was the only professor teacher at one class for him. So that we mark that motor areas, sensory areas. Next one. So motor area and sensory areas is mostly used for areas for gel style scalp acupuncture. So in order to locate these areas, we need two imagination line, and one is called anterior posterior line. It's from glabella in-tongue point connect with occipital protuberance, and you find the middle point. From the middle point of posterior half centimeter, 0.5 centimeter, you get a high point of motor areas. Another line from upper border of elbow, you make a horizontal line. This line will cross with the anterior hairline right here and connect this area. They call motor areas. So motor areas is projection areas of the motor areas on scalp surface, and we stimulate these areas, can treat the opposite side of the body and the face paralysis. And one area behind motor area and parallel to motor areas, 1.5 centimeter is the sensory areas, and they treat the opposite side of normal sensation or loss of sensation. And the one area in front of motor areas is called tremor areas, and there's also parallel to motor area. They treat the abnormal movement. Next one, please. That we measure at glabella, occipital protuberance from the middle point, and the posterior middle point, half centimeter upper point. Another one from upper body or border of the eyebrow, connect occipital protuberance. They cross with anterior hairline, and you find this point. And you contact this point, they become motor areas. In order to precisely stimulate this inside the brain, we divide this motor area into 5 equal parts. 1, 2, 3, 4, and 5. So first centimeter we call upper 1/5 centimeter. They treat paralysis, weakness of leg, trunk, and foot in opposite sides. Middle 2/5, from here you put needle to go down here and treat paralysis and weakness of the sides for the arm and the hand. and lower 2/5 treat opposite side of the face paralysis. And the sensory areas, you divide into 5 equal parts and treat opposite side disorder as well. So in order to get good results, you need precise location at this point. Next one, please. So motor areas, sensory areas. In my book, in my lecture, is exactly like Dr. Jiao described. But if you knew from my lecture, and you will notice that in our chart, the tremor areas, blood vessel dilation, and the contraction area are shorter than according to brain functions. Yeah, so it's only 4 centimeters in length. Yeah, so it's not all the way down. So it's more specific stimulation, these areas. Next one. Why we divide into 5 equal parts and divide upper 1/5, middle 2/5, lower 2/5? Because the anatomy, neurology is have this kind of distribution in the part of motor gyrus and sensory gyrus. So here equal to upper 1/5, middle 2/5 right here, arm, hand, lower 2/5 of face. Next one. So right side the motor areas, left side is the sensory areas, and cut, slice it separate. And in Jiao style, just keep them relatively same. In Feng style, they put a little bit different location. Next one. That you from the top your view. So this area is from top toward in front, right this way, this one right that way. So upper leg, opposite side, arm, hand, and the face. Okay, next one. Okay, it's time for break, and introduction a little bit details, and but you need it, and in order to communicate with the patient and get good results, communicate with the other medical practitioner, you need it. So we're going to take a 10-minute break, and then we come back where answer some of your questions, where each class will answer 2 or 3 questions. The end of the total class will answer more. Please type in your question in the chat areas, and
All right.
We're gonna read it for you. Okay?
Yes,
And thank you.
We'll come back at 1:02 p.m. Pacific time.